Hello, this is Ms. Roberts. I'm covering chapters 11 and 12, the postpartum woman and her family. I like to do the mom first since we just left the labor and delivery part, and then we'll go to the newborn. So I want you to review 11 and 12 first, and then chapters 9 and 10. Okay, so we're starting in the book on page 370. Puerperium is a term that's immediately after childbirth, and it means to about 6 weeks. Okay, so you may hear that term. Focus on safety is just something in the book about identifying the bands, the security bands in the hospital. So these are placed on the mother and the support person, the father, partner, grandmother, whoever's there with the mom. One is placed on each of those, and then 2 are placed on the baby. And they're different types. Some are placed on the umbilical cord clamp, some are placed on a leg and an arm on the baby, so it's just according to the facility. Okay. Protecting the infant from abduction. So we have a code pink, that's what it is in the hospital. So anytime you go get a baby out of the room in the bassinet, of course, you're verifying the armbands. Even when you take the baby from the room, because what if the nurse before you took the wrong baby in the room? So you're verifying the armband. It's usually a 4 or 5 digit number with the mom, and then you verify it on the baby. Okay, make sure that those numbers match. So wink and lollipop, anytime that you're transporting that baby, you follow that facility's protocol. In the hallways, keep the baby in the bassinet. Absolutely no person other than the nurse, the nursing staff, can transport the baby in their arms. And we don't even do that. We use the bassinet for that. But no family members can even transport the baby in the bassinet other than the parents. Okay? Alright, on page 372, we start talking about early maternal assessment. So our vital signs, of course, the range is 98.6 to 100.4. Anything over that would be susceptible to an infection. You're going to see some tachycardia, usually if she has a fever. I want you to note the respirations, okay? A decreased respiratory rate is usually indicative if she's had an epidural of a high block, okay? So this is wink and lollipop. Make sure you're counting respirations. You're not just putting 18 down. Like you need to be counting on these mamas because it can go south in a hurry, okay? Blood pressure. So if it's low, that means that she could be hemorrhaging. Okay, so make sure that you understand that is a sign of a postpartum hemorrhage, is a low blood pressure. Another sign of postpartum hemorrhage is a boggy fundus. Okay, it's not going to be firm like a grapefruit. It's going to be boggy. That can either indicate uterine bleeding or a full bladder. She should have at least about 150 milliliters of an hour of urine output. We say 30 an hour on a normal person, but within the first 6 to 8 hours after delivery, we want her to be voiding a lot, okay, because she probably got a lot of fluids through her IV, so we just want to make sure that she's not overloaded, okay. This bubble EE that I gave you, here's another copy of it, and you'll get another one, but this is, or use the one in your yellow folder, your clinical paperwork, how you do your assessment, okay? This picture just shows the security clamp, the alarm on there, and then identify it. And we'll look at that in class. All right, let's talk a little bit about other signs and symptoms, things you may see. We talk about temperature, pulse, blood pressure, respiration, but we also have a 5th vital sign called pain, right? In postpartum women, the peripuerium period is after pains, okay? This happens when there's the involution of the uterus. When the uterus is shrinking back down, you'll have these after pains. Wink and lollipop, you need to know this term, after pain, okay? Feels like menstrual cramps, heavy menstrual cramps. Anytime she breastfeeds, it can happen because that natural oxytocin is being stimulated. So just make sure you understand that term. And it talks about the breastfeeding here. Okay. Lab work. Testing for postpartum period. Usually blood type, hemoglobin, hematocrit, like a CBC with div, rubella status. Does she need the rubella vaccine after delivery? And then the Clone-Howard-Beck, and that's the fetal red blood cells. Have they entered the maternal circulation? So just be familiar with those. She gets ROGAM at 28 weeks and 72 hours after delivery. Okay, so at 28 weeks and 72 hours after delivery. If she has any type of negative blood, okay, that can happen. Or O positive can play into a factor, because in the O positive we don't have what? We don't have the antigens built up. So it can cross over that placental barrier. 374 is talking about the bubble HEB or bubble EE again. Make sure you understand this. This is a wink and lollipop, this whole chart, okay? Please know this chart. Commonly used medications that we're going to actually be giving in clinicals: Colace, Dulcolax, lidocaine spray, Tux pads, which is the witch hazel pads, ibuprofen, Percocet, just plain Tylenol sometimes we give, and some opioids like Dilaudid even, okay? So be familiar with those. We'll look at these videos about ROGAM in class, just describing the reasons for it and what it does, okay? This is another of the physiological changes that happen in postpartum. We'll review this. And then there's the medications. All right, let's go to the breast tissue, okay? So the breast for a postpartum woman should start filling up with milk about the 3rd or so day. Let's see. By the 3rd day, the milk is starting to fill. Okay, so this is another wink and lollipop. They're going to feel firm and warm. So when we're doing our breast assessment, this is what we're looking for. We're looking for signs of mastitis, and we're looking to see if her milk is starting to come in. Her breast should feel firm and warm, so we're just lightly palpating the top of the breast tissue. Uterus. So these numbers are very, very important. Please understand that this is wink and lollipop. Okay. At day 3, the uterus, the top of the uterus called the fundus, will be 3 centimeters below the umbilicus, 3 finger breadths. Okay, so when I say 3 FB is how we would chart it. So U minus 3 FB. Okay, so 1 to 2 hours it's at the umbilicus, 12 hours it's +1, and you'll see a little bit different numbers in the book later on. 24 hours -1, and I'll tell you what you need to know, but just be familiar with these, okay? This is a wink and lollipop, though, okay? You need to know that. All right, so lochia. This is a term that we used for the discharge of blood, mucus, and tissue after birth, okay? So every 15 minutes for the first hour or two, we're going to be assessing her lochia, okay? And there are different stages of this. This paragraph, these 2 paragraphs, wink and lollipops, okay? So please know what's in here, okay? An overdistended bladder may push the uterus to the right. It will deviate to the left or the right, either side, once that bladder fills up. So that's why it's so important that we ask her to get up and void to empty her bladder if her fundus is not firm, okay? So we're going to chart, is it firm, soft, or boggy? If it's boggy, we're going to massage it until it becomes firm, okay? And we're going to note where it's located. This is a nurse massaging that fundus, okay? I do it with my whole hand. I don't just use 2 fingers, okay? So this is what I want you to know. At 6 to 12 hours postpartum, our fundus, which is the top of our uterus, is going to be at our umbilicus, okay? The level of the umbilicus, 6 to 12 hours postpartum, wink and lollipop, right here, okay? Another wink and lollipop, okay? We talked about this. They're voiding every 6 to 8 hours. It should be at least 150 milliliters per hour to not have the bladder distension or stasis, okay? Every hospital has their own policy, but this is what I want you to know. They have a time that they have to void by it, whether it's 6 hours, 8 hours. If they have not voided after delivery, then we will have to do a straight cath, okay? Another wink and lollipop. So spontaneous voiding does usually occur within 6 to 8 hours, but like I said, you may have to do a straight cath. Don't rush them. You know, turn the water on, let them be, because can you empty your bladder when somebody's standing over you saying, go empty your bladder, go empty your bladder? So just be cautious of that, okay? Lochia. So here's some terms I want you to know, okay? Lochia rubra is the first one. Lochia serosa is the second one. And Lochia alba is the third one, okay? This is the picture that is very important. We'll look at this again in class, but please take note of this. So the rubra is a dark red bleeding that happens 3 to 4 days after delivery. The Lochia serosa is the pinkish brown, and it's 4 to 10 days. And then you have the alba, which is the whitish yellow, and it can happen for up to a month, even 8 weeks of bleeding, okay? It's very important. So the rubra is the dark red, the first 3 to 4 days. This says 1 to 3. It's fine. And then the Lochia serosa is 4 to 10, so like the first 2 weeks really. And then anything after that up to 8 weeks is the alba, which is the yellowish, older discharge of blood, okay? Then we also need to know, I think this is on page 378. How much is it, okay? We'll go back up here and talk about bowel function in a second. But how much is it? Is it scant? Is it just a little bit? Then we're going to chart it as scant. Is it light, moderate, or heavy? And this is within 1 hour, okay? So if you go in and she hasn't changed her pad since 9 o'clock the night before, you can't chart that as heavy. So you need to put a new pad on there and wait an hour and see which one of these pads does it look like, where you know exactly what to chart. Going back up here, so for bowel movement, okay, as long as we can hear gas sounds, we should be okay. But she needs to have at least gas or bowel movement before she's discharged, okay? We don't want her bowels to lock down and her not be able to have a bowel movement and then go home and be stuck. So, all right. So let's go back to the book, on page 378. So this is a wink and lollipop, okay? Know these terms right here, all right? Know all of this information, okay? Episiotomy. So let's look at this. So episiotomy is part of your perineal assessment. Was she cut or did she tear? Okay, so episiotomy means she was cut. The physician, midwife actually cut the perineal tissue to enhance delivery. Okay. So you need to be looking, wink and lollipop, you need to be looking at her perineal area for swelling. Note the majora and minora, any swelling, hematoma even, bruising, injuries, and what we can do for her. So we can give her the lidocaine numbing spray, the witch hazel pads, ice packs. That's the biggest one, okay? Then you have the Rita, so you can use that. The redness, edema, ecchymosis, drainage, discharge, and approximation of the episiotomy, okay? And it's here if you want to use that for the acronym, just to give you a scale on what it should be. Optimizing outcomes, early episiotomy care. So another wink and lollipop. You should need to apply that ice, okay? You use the sitz bath, and we'll demonstrate that in class. The use of a sitz bath is just a comfort measure. It's really warm water, as hot as they can stand it, and they can use this 3 to 4 times a day. Okay, hemorrhoids. These are friends that you can't get rid of. Okay, once you have a baby, a lot of women get hemorrhoids. Okay, donut rings should be avoided. That used to be the go-to, but now they're avoided because it intensifies the pain. That swollen tissue just kind of sinks down into the donut hole, and it makes it worse. Okay, you're also looking for the Holman sign. Very common screening tool that we use to check for DVTs. Okay, so we're checking for DVTs. All right, on page 381. It talks about, this is the sitz bath, but I'll demonstrate that in class. The sitz bath is just that comfort measure. Alright, so physiological adaptations and continued assessment. So of course we're getting blood work, right? Making sure her hemoglobin, hematocrit are well. With a vaginal delivery, you can lose up to 500 milliliters of blood. With a cesarean, you can lose up to 1,000. Okay, so of course this affects your hemoglobin, right? This results in a 1 gram drop in hemoglobin for vaginal birth and a 2 gram drop in cesarean birth. So if she started out before delivery and her hemoglobin was 12, she had a C-section, there's a real good chance it's going to be 10. Okay, so wink and lollipop, please make sure you understand that. This right here. Alright, so let's talk about the neurological system. Alright, so complaints of headache after a spinal or epidural warrants investigation. Okay, wink and lollipop. If she's complaining of a headache every time she sits up, there's a real good chance that she has a spinal headache. That means that when the anesthesia provider put in the epidural or the spinal, he punctured that dura space, and she is leaking cerebrospinal fluid. It's taking that cushion away from the brainstem, and she's getting an extremely bad headache. Okay, there's a treatment called a blood patch, and this is sterilely drawn. We'll watch a video on that, but this is something that can help. You draw the blood out of her AC in a sterile manner. You hand it to the provider, and this is 20-30 milliliters of blood, and he inserts it back into hopefully the same space where he did the epidural or she did the epidural, lays the patient flat for about 2 hours and gives that blood time to clot off and patch that hole. That's why it's called a blood patch. Okay, All right, cardiovascular system. Of course, we know that with pregnancy it increases, so that's how the moms can afford to lose 500 milliliters of blood on a vaginal birth and 1,000 for a C-section. Okay. Most women bounce back within 6 to 12 weeks, so everything should to get back to normal by 2 to 3 months. All right. Rubella. So this is something that's very important. We should check in their prenatal records to see if they are rubella immune. If they are non-immune, and this is something that will be on report sheets, we are giving them the rubella vaccine as soon as they deliver, within 72 hours, before they go home even, because infants can be very susceptible to rubella, so we need the mom vaccinated. She can't get it during pregnancy because it is toxic to the fetus. Alright, I can read through that part. Culture sensitivity. A lot of women do binding around their abdomen. Some hospitals do the binders, but it's just really up to the facility and especially to the patient. Okay, some of them only want to drink warm drinks. Some want to only drink cold drinks. It's just according to their cultures. And activity and rest, nourishment as well. Okay, perineal care. Make sure you read this section. And patient education. So teaching her how to make sure she has, washed her hands. She uses the peri bottle filled with betadine and warm water. Squeeze it on there to keep her perineal area clean. Pats it dry. Removes all old peri pads. Puts a new clean peri pad on every time she goes to the bathroom to empty her bladder. Just make sure we're teaching her all of that. Okay. So tubal ligations, a lot of women have this done for sterilization purposes, of course. They will cramp more. So if you have a mom that is cramping more and you find out that she had her tubes tied after delivery, this is why. Okay. Just like any other surgery, we want to encourage her to get up and start walking as soon as possible. Early ambulation, okay? It's going to make all the difference. She's not going to be as sore the next day. Her risk for DVTs go down extremely, so we need to get her up, okay? Box 11.2 is breastfeeding benefits. So you burn an extra 500 calories a day, get some weight off. It decreases cancer, diabetes. It's less expensive, so make sure the mom is really educated on the benefits of breastfeeding. I don't ever push breastfeeding. If they want to formula feed, that is their decision, but I just educate them on the benefits. Okay. Lactation, the physiology. There's something called the letdown reflex. And if you've ever breastfed, you know exactly what I'm talking about, but it's just a pulling sensation when your milk ducts open up, and the ejection reflex is called the letdown reflex. This can happen when babies cry. It doesn't necessarily have to be her baby, any baby. I breastfed, and anytime I heard a baby cry, my milk would let down. So it's just a natural stimulating reflex. Okay. Let's see what happens. All right. So there's different types of positions to feed the baby. Okay, so you align the nipple with the nose. and make sure the entire areola, just about all of the areola, is in the baby's mouth, where they suck, and don't hurt the mama, because if they're smacking their lips and licking, or they may not be latching on appropriately. Okay, we'll look at the different positions in a second. So what to say, let's see right here. So just make sure you read this. You know, if they're saying the baby's not latching on, the baby's sleeping, you know, unwrap the baby, stimulate the baby, because babies need to breastfeed every 2 to 3 hours. Okay. Assess them for letdown. Make sure you read through this and note the cues here. Okay. This is on page 390. Evaluation of nourishment for weight gain. Okay, so making sure she's educated on eating enough. Wink and lollipop right here, making sure she knows to breastfeed every 2 to 3 hours for at least 15 to 20 minutes on each breast. So that's a total of about 40 minutes she needs to breastfeed every 2 to 3 hours. And I know that's a lot, and it is a lot. It does get better, but she needs to start out every 2 to 3 hours. These are different types of positions, common positions. So you have the cradle hold. This is the first one. Then the football hold, and then the side lying. Okay, so just different positions that you can educate your moms on. If they don't have success on one, they can try another one. Engorgement. So this is a swelling and overfilling. This means that she needs to pump, or she needs to feed her baby. Okay. This does happen. It can be painful, very full feeling, warm. She can take some Motrin, Advil, any type of anti-inflammatory to help with that discomfort, but she ultimately needs to breastfeed. If she's choosing not to breastfeed, she will have the engorgement when her milk comes in. She can take Benadryl that helps dry the milk up. She can put cabbage leaves in her bra that helps dry the milk up. So there's different things that she can do. Collecting and storing milk. So there's a chart in your book on page 392 that tells you the protocol for this. Okay. There's also a wink and lollipop. So let's look at this right here. So wink and lollipop about thawing the milk. Never, ever, ever thaw breast milk in a microwave, because you're going to get hot spots. It's going to burn the baby, and it decreases the anti-infective properties in the breast milk. Even in hot water, you don't want to put it in very hot water. Okay, so this is a wink and lollipop. They have milk warmers that you can set the bottle in, that are very, very nice. Electric breast pumps. Hospitals can supply these. The patient usually can rent these. Their insurance pays for them, or they can buy one, and they can be anywhere from $30 to $3,000. They're very expensive. There's some that are very expensive. Okay. There's some donor milk, and we'll talk about this in class, but there's something that started in about 2012 where for women that don't produce enough milk, can use donor breast milk. It's been pasteurized, tested a million times for all the types of screenings, syphilis, hepatitis, HIV, all the things. Okay. Tobacco, alcohol, and breastfeeding. Make sure you read through this. It's never, ever, ever okay to drink or smoke while breastfeeding, because everything the mama gets, the baby gets, right? Let's see. All right. Formula feeding. So they need to add some fluoride. If they're formula feeding, they need to use the water that has fluoride in it, especially if they live in the country, because not all water has fluoride, of course. City water usually does, but I always suggest that they buy the bottled water that has the fluoride in it. $3.95. It's talking about transitioning to parenthood, the bonding. So remember on your bubble EE, the last one is emotions, right? You're checking for the bonding. You're assessing that bonding, okay? Wink and lollipop. So the on-face position, okay? This is where the mom is face-to-face with the baby, okay? So how she's here. There's some more pictures that we'll talk about. Let's see. So let's go back to this, the episiotomy. So we have different tiers. Sorry, I kind of got lost and didn't cover this, but you have different tiers. So episiotomy is when they cut, right? But a tear is a laceration. So first degree is just like what we call a skid mark, okay? Second degree, a little bit more tissue. Third degree, multiple layers all the way to the anal sphincter. And a fourth degree is from all the way through the vaginal wall. The entire perineum is torn through the anal sphincter. Very, very painful. And we talked about the Holman sign, right? And here's the sitz bath, blood patch. We'll watch that video in class, and then the breastfeeding that we talked about. These are nipple shields, okay? So the nipple shields just kind of help the nipple stay everted, where it's easier for the baby to latch. And the donor breast milk, and we'll look at that. And then this is the on-face picture, where the mama's looking at the baby, okay? And some postpartum education about breastfeeding, cord care, and all the discharge teaching that the nurses will do covers all of that, okay? And some more on-face positions. And then there's some danger signs. Let's look at that. This is just the different phases, okay? Siblings adjusting to a newborn in their home. Emotional events. And there are this is real postpartum depression, postpartum psychoses. So we need to be screening for this. If you work in the clinic, they come back in for their 6 weeks appointment. That's very, very, very important to screen for postpartum depression or psychosis. Okay. Being tired and fatigued is normal. That's a big adjustment. Just make sure your mama's doing okay though. Okay. Locating the fundus. Just read through this. And then the different types of education here. Then we have the danger signs, and it's okay to exercise. That's what they're doing. The danger signs to report. Okay, so make sure you understand that. That's page 401. And reading through the rest of it. And that is it for chapter 11.